majority of community service providers to offer those services that are desperately needed to the community, as well as those that may reside on One Rise. So when we look at the needs from the city, the county, and other areas, they're definitely, the need is great, and both will serve a specific need for our community.
You're going to love this question, Matthew.
A little bit
Yeah.
to that. I think the need around some of these services, whether it's behavioral health or physical health, are so needed in this community that we could have 3 of these and be perfectly fine. What's exciting about One Rise being on the south side is that it's really, if you look at this area, we're a food desert, we're a health desert, we're going to bring all of these resources into this space and really be able to service the south side in the way that it hasn't been in a long time. So that's what's really important to me on some of these conversations that we're having. Yes, right now we're talking about a mental health hospital, but what growth is going to come from that is healthcare, is dental care possibly, is child care. I mean, there's so many things that we need in South Wichita and Hayesville and this just general area that this is going to be able to address.
Yeah, to kind of tag onto that, the other thing is that if there's one thing that's been shown, I mean, first of all, like 1 in 4 people in the United States has a mental health issue. A lot of people don't realize that. So to your point, the need far outweighs the speed at which we can build it. But additionally, like the University of Utah helped build a center very similar to this several years ago, and having people be able to get like-for-like care and know that if they go to one center they can get that care is crucial. Having somebody come in and be like, hey, you don't own a car, but if you go across town to get this one service and then go across the other side of town to get this other service, they won't do it. They won't seek care. Consolidating all that care into a mental wellness campus is the best way to make sure that someone receives all the continuum of care that they need.
So I'm going to, Matthew, there's several questions here for you, I think. I think we've answered what is One Rise, and what does it have to do with the state hospital? You're basically sharing a location, right? Where does my donation go at One Rise? You mentioned it was a nonprofit.
Yeah, it's a nonprofit. If you're asking in terms of how you can be a contributor, we do have a website, onerisehealth.org, where contributions can be made. When we're talking about how those funds are being utilized, we want to see how we can utilize the vehicle of the campus and the 501c3 to create these avenues of services for the providers to be present here in this community.
But stay tuned if you need community volunteers, if you
Oh,
need
yeah.
dollars, garage sales,
all
whatever, right?
of that.
Okay.
Yeah.
Could you also spell out what an FQHC is, and how does that benefit South Wichita?
Sure.
So an FQHC is a federally qualified health center. We have some already in town. I serve on the Health Corps Clinic Board, which is one of them in the area. That FQHC is in northeast Wichita by WSU, and that one specifically was created to look at infant mortality deaths, but it has grown and expanded into what it is today. They are looking at potentially building a second location, and so we've been in the works of talking about could we add that to this campus possibly. Those are still ongoing discussions on what that could look like, but when we look at health corps clinics patients, a lot of them are south side, and a lot of times what we see is they have problems with transportation getting there. And so not only is it a health clinic, but we also offer Uber rides to and from the clinic. So if you don't live close enough or you don't have a ride, so that'll help cut down on some of those things. They also offer things like legal services, because we know that if you need healthcare, and you could possibly also have issues with if your electricity goes off but you need to plug in your CPAP at night. Well, how are you going to do that? So these clinics help with a variety of things like that. And so Health Corps is one that has kind of been in the works with One Rise for a while and is still having those ongoing conversations. But I would love to see Health Corps or another FQHC come to this space, because it really will offer a lot. And I'll tell you, my doctor's office, I live South Hayesville, my doctor's office was way on the other side of town. If we could get an FQHC right here, then I would transfer my family in a heartbeat, because I believe in the work that they do. And another thing is more community members that go to FQHCs help fund others who don't have insurance. And so the more we can get community involved in this clinic helps everybody around who can't always afford those things too.
And if you're interested in the concept, Community Care Network of Kansas is the state association of all the FQHCs in the state.
Yeah, and the other thing about FQHCs is they actually often offer multiple services under one roof, whether that be dental or mental health or primary care. There's a pretty critical link between dental care and your need for additional medical, for instance. So a lot of FQHCs will offer those services. So, because again, if you leave and you don't receive the treatment, you may not go back. The federal government, when it supported those, actually that was part of the incentive of having those clinics.
Pharmacy is also oftentimes involved. Listen to us. We're preaching on the FQHCs tonight. All right. So they're good. I live in a neighborhood with one and was on a board for 14 years. It's a good thing. It's 7:27. We told you we'd be done by 8, so I am going to do last call on questions, if you don't mind. I've got 4 more here, but please, just to keep sending them on this way. Scott, I'm going to put several staffing pieces together here. So do you plan on the staff being contracted or state employees? And if they're contracted, who oversees that contract to ensure that everything in the contract is being met and the quality of care is there?
That was just 2 questions.
I got more. You go
Okay.
ahead. I'm
So
reorganizing my thoughts.
One of the questions that we charged the advisory panel with working on was, do we privatize the operation of this facility? Do we contract the whole facility out to a private vendor who would then hire the staff and do a lot of the work? We've been talking about that question. We've been trying to gather information about it and what other states do. The governor's not interested when I asked her about that same question and talked to her about the discussion that we've been having. She wants us to be a state hospital run by the state with state employees. So that's our approach at the moment. We do, at Larned and Osawatomie, we both are very dependent on agency nursing staff to fill in the gaps in our staff. So I imagine we'll do some of that, but our intent is to hire state employees. For those where we do, we work in a lot of different models where we have some contract physicians. We don't hire a dentist full-time. We have a contractor that does that work. So we've got a lot of experience in managing the work of contractors. The bottom line, so that would be our state team overseeing the work of those under the direction of our state-hired medical director and others. So we've got a lot of experience doing that. The main thing maybe to leave with that question is the standard of care that we meet is the one that we set as a hospital. So if there's a medical error that a contractor does, we treat them like we would a state employee. We investigate it the same way. The one thing that is a little different, if a contractor we can release from employment a lot faster than a state employee. But in term, there are staff, they're doing work for us, and we treat that the same way. So, we've talked about, there's, again, with all of the opportunities and being a little bit of a blank slate, there are some state hospitals that work directly with medical schools, do joint appointments, so somebody's teaching part of the day and working some at a facility. So there may be some partnerships like that, but the intent is primarily to have state employees running this facility.
So while you're there, you're getting both well wishes and pointing out that this might be an impossible task. So no, that all comes in one card of getting enough people to staff this big a hospital.
Which one was first?
I'm not
Was
going
the
to tell
well-wish-
you.
Okay.
I'm not going to tell you. But could you please restate the numbers that you expect to need of staff?
Of staff? Somewhere between 250 and 320. That would be inclusive of clinical folks, nurses, direct care staff, our administrative team as well, which to run a certified hospital, there's a lot of infrastructure you have to have around medical records, but I think 320 would be a pretty fair number based on 104 beds.
Thanks for that. We have a comment here, thanks to the good citizen who helped bring us up to speed on another topic, USD 261, somebody help me with which one that is? Hayesville, thank you. Also has students who are going to WSU Tech. We're working on growing our program. WSU Tech teaches CNA, which is Certified Nurse Assistants, and CMA, Certified Med Assistant classes here at campus. We also have a med clinic for students with KU Med Center. So thanks for sharing that. Good news. And then the last is more of a open-ended question for any of you. How can the community best support this effort? It's a real question. I didn't make that one up. It's real.
I don't know who wants to go. I guess I'll go first. I've still got the microphone. I think, letting us know ways to keep you informed. That's certainly our intent. I don't know that, we try really hard in this kind of setting. This doesn't work for everybody. And internally, we've talked about that of what else can we do to get, particularly when the renderings are available now, to kind of show you what the building's going to look like, talk about the model and how it fits with things, what's effective ways to do that. That would be really helpful feedback. If there are partners that we haven't talked to or that you think we ought to talk to, that would be really helpful to know. The kind of county folks, ComCare, the sheriff, others. We feel like we're plugged in there. Some of the local coalitions were plugged into those as well, but I feel like, schools are a little bit more of a challenge. But so if there are other ideas like that of have you talked to this particular, it may be a particular person. In a couple of these town halls, we've gotten names of particular psychiatrists or clinicians that, have you talked to them about their experience? And that's been really helpful to do. So I think giving us more ideas about how to communicate about the project and what would be most effective would be really helpful from my perspective.
From the OneRise perspective, we want as much community involvement as we can. So we invite anybody to have a seat at the table to talk with us, to work with us, and join in as we continue to travel down this journey of understanding how we can make true change for South and Southwest community as well as our region and state here. So that's our open invitation to anyone who feels called.
From my vantage point, I would just say keeping an open line of communication. If you guys have any questions or concerns that pop up, please let us know and let us address those. Some of these projects are hard when misconceptions get out there and those grow, and one thing turns into another thing. So if we can address them and really talk about the reality of the project and what this is going to be, it makes it a little bit easier to have those conversations. So I would just say, if you have any questions, if you hear anything from anyone that they're concerned, but maybe they don't feel comfortable reaching out, do it on their behalf. I'm happy to either meet with you or just have a phone call, like I said, but really just having your support and some of these things is just incredibly important for this. And it helps destigmatize, like we've already talked about, the work that we're doing. We've talked about having multiple town halls. This is an example of us doing that, but I also want to see us have an open house before we open the facility. So I would love to invite the community out to the hospital, be able to take a tour so you can actually see the facility, so it's not just some unknown building that you're worried about what could potentially happen. You'll have real experience inside. You can see what's going on, and then if you have additional questions from that, we're there to answer them. So as we get this started and get this built, we will let everybody know and make sure that we're inviting you out to that as well.
Commissioner Lopez talked about how she is available. One thing that we're trying to do at the county is make sure that we're updating our website, and that's on the cover of our website, just to make sure that the community is aware of everything related to this hospital and constantly putting updates. So that's one way to make sure that you're updated on what we're doing with the mental health hospital. Another thing is we're engaging on social media. One thing that I might put out there if you think is helpful, and I'd like to hear from you, is if there's any opportunity to put some kind of engagement on our website where you can submit a question, we can get back with you, if that would be helpful. Of course, as Commissioner Lopez said, she's available, I'm available to answer any questions via email or phone. So just, again, we're just trying to make sure that we are letting the community know where we're at on this project. So, Basil.
See if I can get far enough from that thing. Well, and I think everybody's kind of said it, but I'd say advocacy. I mean, obviously on my side of things, we work on the design and construction side of the world, and there's going to be a lot of workers involved in building this facility. Be excited about that. Be excited about what it's bringing to the community, and talk proudly about, hey, I helped build that, or my son helped build that, and the difference that it's going to make to the community. The more we do that, the more it's going to prop up this facility and others like it in the future.
Thanks, everybody. So that truly is the end of our questions. I'm not seeing anybody rushing the stage with more. So for the last 2 minutes, would you please give us some feedback? Everybody's used to these goofy things now, right? If you would take a picture of that with your phone and give us some feedback. But for those of you who prefer a paper copy, you see Don and Ryan right there, wave your hand. This is where you can sign up to get email communication later on. Tell us anything you would like us to know on here. You're welcome to share that QR code with anybody else, your mom who didn't get to come tonight, or whoever it is. There's also a way to stay in contact full-time on both of those sheets of paper. So I want to thank everybody for your kindness tonight. And for your willingness to write your questions down and ask your questions and your comments and your thoughts and your attentiveness during this hour and a half that we've spent here together. As I mentioned to you at the end of our time, all the panelists are happy to stick around, and if you would like to come up closer and look at any of the maps or anything of the slides that you want to see a little better, if you want to have your moment on the stage, you can have it. We'll turn off the mic and you can talk. So thank you so much for coming. Please take care of yourself and those that you love, and maybe somebody you don't know during this heat spell. And please drive home safely. Thanks for your time.
And if you don't mind, I want to add one more.
Oh, sure.
I want to thank campus for allowing us to be here
Oh.
tonight. I mean, it's summertime, and they
Yeah.
opened their facility here. Where this is going, some of the kids that live in the general area either go to South High or Campus High. So we've had the first town hall at South High. I thought it was really important that we had one here at campus too. So grateful for the campus staff for opening this up and allowing us to be here tonight.
And thanks to Kevin hiding back in that room running YouTube so the rest of Kansas can watch along. So thanks, everybody. Good night.